My husband was diagnosed with cancer. He was very, very poorly. There was no involvement from anyone with the hospital. There were no interpreters. Nothing to help me.
Using my Minicom, if I want to book an appointment with my GP, and I say, yes, please, I'd like to book an appointment with an interpreter, please. They agree, and when I arrive, there's no interpreter. They say, can you just see the doctor? Can you try? And I sort of say, okay, I'll try. Some doctors are good, some you can understand, some not so good. We've got one lady doctor who wears a niqab. If I can't understand it, I ask her to please remove the mask and take it down. She doesn't like to, and eventually she will agree.
The problem I have is appointments for my daughter. I mean, she's only 6 and she regularly has water infections. On that day, you're supposed to call up. How can I do that? There's no text access or email for me. So I have to rely on my husband, who's hearing, to make appointments. But it has to be at 8 o'clock in the morning. And when he eventually can do that, I go with my daughter. There's no interpreter because it's the same day appointment. And I just have to go with my daughter, who's 6.
I can't have an interpreter. They tell me every time, refuse to provide or offer me the service of an interpreter.
I had an appointment with an interpreter booked. I was really happy about that. I drove there and I arrived and I sat waiting and waiting. And then someone came up and said, come on. And I said, no, I'm waiting for the interpreter. They said, come on. And I said, no. And then they forced me. And I was like, okay, I have to give in. I was quite frustrated and disappointed, really. I need an interpreter.
My problem started last year. I had a mental health crisis. So I had an appointment with an interpreter booked. And when I arrived, the first appointment, there was an interpreter. I was satisfied with that and I explained all my personal issues with the counsellor. The next time, 2 weeks later, another appointment arrived and booked with an interpreter. I expected an interpreter. There was no interpreter. It was a laptop with a video link. And I thought, it's okay, I'll give it a try. I wasn't really satisfied with the signing and I had to explain myself. I thought, okay, we'll try again later. The next time, 2 weeks came, I booked an interpreter and it was a laptop again. Okay, I came in and I started to become frustrated. The communication just wasn't there. The context wasn't correct. The counsellor, well, the 3 of us all together, we just didn't seem to gel. I couldn't communicate with them. I was with my daughter at a family funeral. I felt my phone vibrate. When I looked at it, it was a message saying that my hospital appointment was cancelled 1 hour before I should have been there. 1 hour before. I was so frustrated. Luckily, my daughter, who was with me, she lives in Leeds, but she decided to go with me to help us communicate. And they said, sorry, there's no interpreter. And she said, but I'm here, I'm my daughter's here. No, we can't do it. You must wait 2 weeks. I can't wait. I was so angry. 1 hour before.
It was during lockdown, so it was really hard. There was nothing for me as well. The Macmillan nurse was lovely, and she helped me best she could. And I told her I need to see my husband more than 1 hour a day. It's not enough. He's by himself. He's a deaf man. There's no one to communicate with. The nurses can't talk to him. He was so upset. Broke my heart.
I have to ask someone to ring for me, but I don't like that. I like to try doing things myself. So I go into the GPs and they tell me what time I have to ring back at 8 in the morning. I can't. And if I do use Type Talk and ring, they don't pick up. I have to wait for the next 2 or 3 week appointment to be available. It's important. I want to see someone now. So I have to go to a walk-in centre. There are no interpreters at the walk-in centre. I do have a face-to-face appointment, and some are really good and nice and patient. Some not really good. I always say to them, I don't bite.
When I get in the doctor's, we're left sitting and waiting, and it flashes up with your name. But sometimes nothing flashes up, and I'm sitting, waiting, and the doctor might be shouting, and I'm just waiting. And my daughter eventually taps me and goes, Mum, they've said my name, and she has to go with her. So we're going to see the doctor. When we eventually get in, they're always head down, typing. And I'm like, Excuse me, I'm deaf. You need to look at me. Can you lip read? Yes, I can, but I need an interpreter, really.
Look, I'd like a face-to-face interpreter, please. Not on the laptop, it's my right to have one. And she replied saying there's none available moving forward face-to-face. So it'll be laptop or nothing. And I said, I'm sorry, no, I'd like a face-to-face interpreter. It's my right to have that. I don't feel comfortable without one. And then the counsellor discharged me. I was so shocked because I refused a laptop interpreter. They discharged me. I stopped arguing. I wasn't satisfied. I was frustrated. Interpreters are so important to me. It wasn't fair at all.
They turned the screen round, pointed at that and typed at stuff. I'm looking at it all, thinking, what is this? Over my head. Didn't understand any of it.
We went to the opticians together, booked an appointment. I asked for an interpreter and they said, no, we don't have the budget for that. So we had to go without. So the next time I went with my mum, the three of us went in and they told me I had to wait outside. And my mum and my son went in with the optician and I said, no. I want to be involved. This is my son. I want to know what's happening with his eyes. And they said, nope, you have to wait outside. So I just sat there and left my mum and my son in there.
Recently, the doctor noticed me signing with my daughter and the doctor started talking. Can you tell mummy this? Can you sign this? And I had to say, no, I'm sorry, no, that's not right. I'll write down, you and I together will write down, I'll just have to put up with it. You're not using my daughter. I don't get 100% of the information. I feel like it's not fair. My daughter's health is just as important as everybody else's. It always happens.